I'd like to call to order this meeting of the Board of Public Health for Thursday, May 14th, 2020. We do have a quorum as we have all three commissioners present. Commissioner Fund is on Zoom. Commissioner Stamper is on the phone. For the flag salute today, Sheriff Snozzy, would you lead us in flag salute, please?
I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So we have nothing on the consent agenda, and so we'll move forward to the public health update. JP.
Sure. We have a PowerPoint that's going to walk us through the public health update and our COVID update and our discussion on the variance application. And so if we pull up that PowerPoint, that'll walk us through kind of what our presentation portion is for today. And then, as always, hope to have lots of time for discussion, questions, and answers afterwards. And while we're going through the presentation, obviously, if there's any... yes, Commissioner.
Fun. I think Commissioner Stamper's on the phone. Can we email this presentation to him so he can look at it?
Absolutely. Sandy, are you able to do that? I can. Okay, Candy, thank you.
Thank you.
Is this just going to be on our business, like our normal one, like we have on our calendar?
This didn't get emailed out, did it? Did this get emailed out? Okay.
You know what? Don't worry about it. You guys can, I'll just follow. I'll get the PowerPoint later. I'll just try to follow along, and if I have questions, I'll ask. Because I've got some other things going on here too. So, yeah, we're good. Don't worry about it. We'll catch up. And again, if I have questions, I'll let you know.
Okay. This PowerPoint, like all of our PowerPoints in the last 3 months, have been developed the night before the day of. As we've worked on COVID-19, information on it and our status has changed quickly. And so it's a brief PowerPoint. And again, if you've got questions, feel free to ask them anywhere in the middle of the presentation today. Next slide, please. It wasn't quite this brief, though. Yeah.
Bear with me, I gotta redo it.
Okay.
For those at home that might be watching, we are having, there we go. Well, we just got through them. So, okay. JP.
So we're going to go through our COVID-19 case updates. We've got some updated information there. We don't want to walk through too much time on that. We've done that several times. Feel like everyone's up to speed, but we've got a new map and some new information on cases here in Lewis County we'll go through. We're going to talk about case and contact investigations. There's been a lot of discussion on that. And just this week, there's been some information coming out at the state level from the governor's office on that. So we'll comment on that and how that work may likely be conceived here in Lewis County. And then we'll talk about the variants that we've been discussing. And then we'll go into next steps. And hopefully that's a time we can share kind of our thoughts on next steps, learn from the Board of Health what you believe next steps should be, and try to find some ways forward for us to make the most use of our time as we are in the current phase that we're in. Okay, next slide.
And Candy, you're sending this to me? Okay.
Okay, so this slide just shows our most updated case count, and this is by date of diagnosis. So this shows our 32 cases. We can see that we've had some pretty recently, the most recent one diagnosed on the 11th. One thing to note is that the State Department of Health website has a great dashboard with county level data available. Unfortunately, the data that I believe they still have up is not correct. They show 33 cases, and that is due to one case being counted twice because the person was tested twice. So we're working with them to get that deduplicated so that all the numbers are correct. Any questions on the case counts or anything with?
So we're
cases?
still at
32.
32.
Yeah.
Okay.
So,
And once again, put a chart together, and you put lines up and you have the N being so small of 32, and it looks really bad on the 27th of March, but it zoomed up to 4 cases. So it's, if people just look at it without looking at the numbers, it could be a little deceiving.
yes, that's very true, that with these small numbers, one case or 2 cases on a day can look really, really significant, but we need to keep in mind that they are just 1 or 2 cases.
Right.
A couple of other things to note. Go ahead, Commissioner Fund.
I think Commissioner Stamper had a question.
Yeah, I've just, a little bit, I didn't quite hear that. So we currently have 32 cases. Is that what I heard, what I'm hearing?
That's correct.
And so my question is, and we just what was it, Tuesday? We found out we had another one. Is that what I heard?
We had 2 additional cases this week. The chart, this graph is a little confusing because it does show cases by the day that their positive test came back. One of the cases that we found out about this week was actually tested last week. And so that's some of the discrepancy there.
Okay.
And
Thank you.
of the 32 cases that we have to date, 10 of them, so about 30%, have required hospitalization. And for the recovery data that we have, 22 of these cases are at least 28 days past their symptom onset date, and 22. And of those 22, 19 of them, or 86%, are considered recovered. The other 3...
19, so that's a new number for us.
Yes.
19 covered.
So we have 19 recoveries, and then we have the 3 deaths that have previously been reported. And so that is a 14% mortality rate.
So, John, when was the last death? I apologize. I don't have that information in front of me. When was the last recorded death?
I'm sorry, I don't have that information with me right now
It's
either,
been
but I can
several
get
weeks
that.
ago.
Yes,
Yeah.
it's been several weeks.
Okay, that's what I was kind of curious because as far as I know that we had deaths, but they were a while back. So anyway, okay, thank you.
We have 10 currently that we're watching in terms of the recovery.
Yes, so 10 folks are still they haven't met that kind of mile marker of being 28 days out past, the date that they first became ill.
Okay.
So we'll have updates to those. Some of those folks are coming due for a check-in next week. So next week we will have updated numbers with hopefully more recoveries to share.
So just going back through my email here, looking at press releases, it looks like April 21st was when we announced that 3rd death. So
Thank you.
Thanks, Eric.
Next slide. So this slide shows the testing that's been reported. So again, this is Lewis County residents, regardless of where they get testing. There's a kind of grayed out area to the right that shows that we don't have complete data for probably the last week because there's a lag time with reporting. But you can see that there's definitely a weekly pattern. Testing goes way down on weekends, but you can see that 2 weeks ago, we had a significant increase in the number of tests that were done. And I'm working with the State Department of Health to get some data that I can analyze so that we can answer some questions about that, because we're not aware that testing became, that dramatically more available. One of the things that we're thinking may account for that a dramatic uptick is we know that healthcare systems that week started to test patients so that asymptomatic patients, so that they could be cleared to go in for surgeries. So that was happening, as well as the antibody test, the blood test became available.
So this is a mixture of all of those different tests?
Yes.
Okay.
Yes, whereas prior to that, it was only symptomatic people who were getting tested. And I guess just to clarify, so we really want to find out what the components are that, again, led to that increase, because from the public health side, we're really concerned about the number of tests that are done to find active disease in symptomatic people. There may be other indications for the utilization of the antibody test, and certainly we support healthcare in doing their testing to clear folks for surgeries. But what we're more concerned about is what does the population look like? And so we're wondering, we're just wanting to make sure that symptomatic folks are still getting tested and looking for active disease. Because again, the antibody test is looking to see, did you have it in the past?
So John, it looks like that between April 20th, April 22nd, we had our largest spike of positive cases. And since then, we went a whole period there from the 22nd of April all the way until the 4th of May. And we had, looks like, quite a few tests. And I understand that there's a mix of those tests, but no positive cases. And since then, we've had, what I'm looking at is 3. And that's happened since around the 23rd of April up to the 4th of May.
Yes.
Okay. All right.
And this data, unfortunately, doesn't match the last slide completely, because whereas the last slide was reported out on the date of diagnosis, this reports out on the date that the sample was collected. So that's going to be a couple days before, typically 2 days before it actually comes back from the lab as either positive or negative. And that's just reflected on, that's the way that DOH, the State Department of Health, is reporting the data out.
Commissioners, any questions?
I've got a question on that. Obviously, Governor Inslee is looking at a larger picture versus the counties, but have we had any indicators? Because I know that, is this going to be part of our variance information that we will be sharing with the governor, that our curve has, it's on a steady decline, and I don't have the information in front of me. So as part of that, is that going to be part of our strategy? I hope it is, to indicate our numbers. And of course, I know he has those numbers, but I think when we submit this, it could, I'm not saying it's powerful, but at least this is information that we have, that we're monitoring, and we see virtually every day when we have meetings.
Yes, that's correct. And we will be reporting out in our variance application. I mean, in the draft, we already have now what is now outdated, but we would update the data to show that right now we have about a 2.2% positivity rate. So out of 100 tests, 2.2 would be positive, so a little over 2. And that is pretty good, and that certainly meets some of the thresholds that are being thrown around as possible potential alternate criteria for seeking a variance. And JP is going to talk about that in a couple slides. So next slide. And this slide shows a map of the county by commissioner district, and it's just a way for us to show the relative number of cases per district. And because the districts have roughly the same population in them, it gives a pretty good idea of the relative burden of disease.
So John, since the other two commissioners, I don't think have this information, would you go through those numbers very
I
quickly?
do.
you?
Yes.
Okay, well,
I
I know
do.
Gary doesn't, so,
But
Sure.
but let's go through those
Yeah.
numbers real quick.
Yes, so in Commissioner District 1, we have 18 cases, and that works out to about 7.2 cases per 10,000 people. Commissioner District 2 has 8 cases, which works out to 3.2 cases per 10,000 population. And District 3 has 6 cases, which works out to about 2.4 cases per 10,000.
Gary, did you hear that information?
Yes, I did. Thank you very much. That's very much appreciated.
Oh, you're very welcome.
And I'm leading in this category. I'm pretty competitive. I don't like leading with 18 kids.
You're winning.
Well, as
It does-
Commissioner Fund and Commissioner Jackson know that usually I win one of the categories, and we know which one it is.
Every now and
Sheriff's
again,
Department
yeah.
reports.
Yes, we do. So what this tells us is people who've had the diagnosis, we don't have or cannot reveal the data that would be how many recovered in each one. You know that.
I'm sorry, I didn't hear the question.
Are you able to give us how many in each district have recovered? I've got a diagnosis of 18
That's a good
in
question.
District 1. How many of those 18 have recovered?
I don't have that data today, but we can look about reporting that out next week.
That would be good.
Okay.
Because when we're talking about, go ahead.
Oh, I was just going to ask, this is information that we can put on our website, correct? What we're receiving right now, as
Yes.
far as the number of cases. And then I think, go ahead, Commissioner Fund.
Yes, because I was wanting to know, like, the number of cases of my 18, how many are recovered, and then that leads me with how many are being reviewed or case managed for their recovery. So it tells me cases, but how many of them are active at this point? And you're going to let us know that by telling us how many have recovered.
Yes, I will work on getting that data for you next week.
That would be
For all
great.
3 districts?
Yes.
Yes, thank you.
Any other questions? Okay, next slide. So that kind of finishes off our data segment. I did just want to review very quickly what case and contact investigations are and answer any questions that anyone might have. Our case investigations in public health, this is kind of the bread and butter of disease control as far as public health. This is something that we do every day for a huge list of notifiable conditions. So these can be diseases as rare as anthrax or as common as whooping cough. So again, the particulars of what an investigation looks like may be a little different, tailored to the specific disease, but overall the steps that you'll see on this slide, and we'll get this shared out, are going to be the same. These conditions are all mandated to be reported by healthcare providers who diagnose them, as well as the labs that are running the test. So between those two providers, we are getting notified in public health. Governmental public health is the only entity that is given that information, and that is specifically so that we can do this follow-up.
So John, I know that there has been a call from specifically the governor's office for mass testing, for a lot more testing than we've even been able to do. But I'm unclear about what the matrix is for that, because I know that the current testing model is people that are asymptomatic. Is that continuing? Is that going to continue to be the model? Are they looking for other things? Because it seems like Lewis County has done so far, based on what the information is that you're giving us, we've done a very good job at testing asymptomatic people. So
Yes, symptomatic people, so people with
Excuse me.
symptoms, exactly.
Yeah.
So I think one of the things to keep in mind when the governor is speaking is that he's speaking statewide, And statewide, and specifically in specific counties, things look very different. So
Mhm.
there are counties that are returning more than 10% of all tests that they do are coming back positive.
Mhm.
So yes, Lewis County is doing very well, again, being at about 2% positivity rate. So it's not clear. We haven't received any indication that guidance would ever change to recommend that just everyone, regardless of
Mhm.
symptoms, get tested. So it is, I think, an open question as to, in a low prevalence area, what a realistic testing volume will be. And I think that remains to be determined. But again, statewide, we're not there yet. In Lewis County, maybe we are. And again, that's kind of part of our case for this variance.
That's good information. Thank you.
So again, with case and contact investigations, as I mentioned before, we are notified by healthcare providers and by labs who diagnose a variety of conditions. We then reach out to the person who is diagnosed and do a voluntary interview with them. Typically, a big part of this is answering questions that they may have. So their healthcare provider is definitely the person that they should be going to with their primary medical questions, but sometimes we can give a little bit more information that they may still need. We're collecting some demographic and health information, so typically we're really focused in on the symptoms that would be indicated by this disease and just making sure whether or not they have those specific symptoms. Another big piece of this then is to identify contacts. So these are folks who, in the case of COVID-19, would be typically really close household contacts, or as we see things open up more, it would be a close work contact. So it's a little bit different than what you saw last year when they had the big measles outbreak in Clark County, where they were publicizing, you know, that if you were in the Walmart between noon and 3 last Tuesday, you're considered exposed. The route of transmission for this is not that airborne route that we were seeing with measles. So what the limited information that we have from case investigations to date is indicating that it's really close contacts who are most likely to have been infected. And so that's where we're really focusing our interview on. So once we kind of get from folks a list of people who are contacts and need to be informed, we would then work with the patient to come up with a plan for how that's going to happen. Typically in a household, the patient will have already told their housemates or their family members. Work might be a little different. So we just want to make sure that everyone's getting notified in the appropriate way. And then we have some great written guidance for cases, and then we share that with them. Again, making sure that they understand that they can contact us at any time if they have additional questions. Part of the fact that this is a voluntary system, we can't compel people to name contacts. So we do a lot of work building trust with folks because we really need them to trust that public health is not going to share any information that could implicate or indicate who it is that has this
That's going to
condition.
be a tall order.
Yes. But it is something that we have done in the past with conditions that are as sensitive as HIV. So we have experience with that. We have protocols with that. But yes, I think that is going to be a concern in people's minds. And so we're ready to address that. Sounded like there might be a question.
Commissioner Fund?
Yes, when we say identify contacts together, so our staff doing that, or we have Department of Health of the state level, or licensing, are we doing it, or who's, right?
Right now,
talking
it's a
about-
Right now, it's a combination of our staff as well as backup staff from the State Department of Health. So they have cross-trained hundreds of their own staff, as well as now hundreds of National Guard and other state workers to assist with this. So typically, for interviewing the case, We would want a very experienced person doing that. So we're typically reserving, and the state is reserving, the cross-trained folks from other state departments as well as the National Guard, reserving those for contacting the people who are only contacts, so named contacts. Again, because that initial interview with the case is so important.
And in the variance, what's the number of people we have to have contact tracers? How many was that?
There is not a specific threshold named. We, in the first draft that we have of the variance application, we utilized some assumptions that were made by the State Department of Health around
Right.
workload that people could handle, and basically it indicated that, yeah, with 5 folks, we could manage 8 cases per day. And right now, the highest that we've had to date is 8 in a week. So, but again, we don't know what a surge would look like. And so it's a little bit difficult for us to plan for, a potential surge of 30 cases in a week. And it kind of difficult to staff to that. So that's why part of the reason it's been really great to be able to lean back on DOH to help us, should we exceed our capacity.
And isn't it true if we do that, the CARES Act, through Department of Commerce, that those positions, if we had to have people dedicated to this, it would be covered by those dollars?
Yes, that's one of the allowable uses, and there may be other funding streams in the future available for hiring contact tracers as well.
So I think part of it that we can, take a load of cases like 8 and be able to do contact tracing to satisfy the needs of the variance, correct? We need to be able to say we can handle that.
So Commissioner Fund, this is JP. The number that's being used right now statewide, when they talk about readiness and they talk about the efforts underway with the Army Reserve and the staff from Department of Licensing, is 30 contact tracers per 100,000 population. And so that obviously would be much more significant amount of staff than we currently have locally to do that. Whether that will be moved into local capacity or if that would stay at the state capacity remains to be seen.
Just a point of reference, I was looking on the internet and I received the Oregon contact tracing and all their variants, and they have said 15 contact tracers per 100,000. So our state is looking for twice as many, it appears, just as I go through this document. Okay, thank you.
So can I ask a question on that specifically, because I'm trying to follow the dots here. So we have to have 30 contact tracers for every 100,000 population. Is that what I heard?
No, Commissioner, it's not that we have to have them here locally, but I believe that that's been the figure discussed,
Yeah.
that the state would have that capacity. And so the state in their buildup of capacity have heard that as a target. I think that's been a bit of a moving target, and the number has changed over the last month several times as to how many they're looking for. That's the most recent number that the state feels would be adequate. In our instance, to take that and extrapolate what we would need, that number seems to be, I guess, well above what we imagined we would need to do this work. Although with, the amount of testing we've done, I guess it's feasible that that could be a realistic number. We will need to kind of go forward with that. But yes, that's a number that's been moved around, but we are not required to have that in our variance application or to show capacity at that level in a variance application.
So we have, based on our numbers, we have the ability to, enough contract tracers based on the cases that we fit the criteria at this current current time?
Yes, we have enough for 8
Okay.
new cases a day, and that would be the amount that we've had so far in a week.
Okay.
We're trying to check off those, aren't we, Gary?
Well, I mean, I guess.
Yeah,
It's
Yeah.
frustrating.
yeah, I get it.
Okay. Moving on.
Okay, and just to finish this out, once contacts have been identified, we would be reaching out to them. Again, this would require a slightly lower skill set. So could look at folks who are cross-trained or received, a pretty significant just-in-time training to reach out to contacts. What we're doing there is just notifying them of their contact or potential contact. It's also really nice to have a separate person do this because not so much probably with this disease, but with other diseases, the first question that people ask is, well, who infected me? Who exposed me?
Right.
So it's really nice
Yeah.
to have a person who's interviewing them who doesn't even know the name of the case. I mean, it just keeps it 100% ironclad that we are not breaking confidentiality or giving out any identifiable information. Because yes, again, people are very curious about that particular point. So again, with these folks, with the contacts, we would be doing a lot of education, answering a lot of questions. We also want to ask them about symptoms, because if they have symptoms and are a named contact, we would count that as what's considered a probable case. That wouldn't show up in our official case count, but we would also encourage them to go and get testing in a way that doesn't expose anyone else. So some of the last things we would be doing that are a little bit different for this condition, one of them is planning for a successful quarantine. And again, because we would be requesting that folks quarantine for 14 days after their last exposure, that is pretty significant. One of the things that we are working at putting into place is some case management service. So that would be different from the contact person, but the contact tracer would be finding out from the person who needs to be quarantined if there are any services they need in order to stay home and not leave their house for 14 days. So that could be anything from needing to pick up prescription to needing to have food delivered. There are just a variety of needs that people might have. So JP will, I think, talk a little bit about how we're working to meet that need. And that, again, is a little different than what we would typically do in, say, a salmonella investigation, or, there are a lot of other diseases we investigate where we don't quarantine people.
So to go back to something you said a minute ago, that people are curious about how this is supposed to work, I can tell you that beyond curious, there's concern.
Yeah.
Because the enforcement of this has been discussed, and no one is quite clear yet on what that is supposed to entail. But that's one of the big questions that our citizens are going to begin to ask, is that they're hearing on the state level that there will be a level of enforcement of quarantine. Can you speak to that at this moment?
What I would say is, with other conditions, it's extraordinarily rare that we would ever move into any kind of punitive or legal enforcement realm, that this is a voluntary system. The health officer, Dr. Wood, does have the authority to go so far as to have folks incarcerated, but I don't believe that's ever happened in Lewis County history. So it's something that, there are a multitude of legal steps that we have to go through if we were ever to try to go down that path. There has to be documentation that we initially started with the least restrictive measures and that the person repeatedly violated those. And that's typically used in something like tuberculosis, where we're case managing someone for a year or more. If we're looking at maybe asking someone to quarantine for 5 days and we find out on day 3 that they've broken the quarantine, I mean, there's no effective way, even should we want to. Again, we would have to start out, once we first find out about something, we would start out with trying to work with them to give them some education about why they really should stay home, and then have them enter into some kind of voluntary agreement to do that. And then it could be a day or two after that they would be released from quarantine anyway. So I'll let Dr. Wood maybe speak more to this if she has any additional comments.
I'm most familiar with this with regards to tuberculosis because of the long duration of treatment. So with that, there's a due process, and you have to be clear that the individual has understood what you educated them about. And that sometimes there can be language barriers or other things that you really have to ensure that there was in understanding. So in the case of this pesky virus, we're asking people to do this voluntarily for the protection of everybody, because unfortunately there are vulnerable populations among us, and I've spoken to many members of the public who have elderly parents or have a sibling that has some ongoing chronic illness, and nobody wants to think that they might have infected that person and gotten them sick with COVID. So I don't have much more to say.
Any additional questions?
Commissioners, any questions?
Nope. Continue, please.
Yeah, I don't know what the agenda is specifically, but I know that we could probably continue this meeting for a long time. So could we get to at some point, could we get to the level of the, I don't know, the bullet points or the, what's required by the governor? There's stages, and is there an opportunity to get to those? See specifically what we need to do and where we're at with our application for the variance?
Yes, Commissioner, we'll be talking about our variants, where we're at, what those requirements are, what we would need to accomplish to petition to move to phase 2. We don't have a slide outlining all 4 phases, although I would guess we could probably find that fairly readily, and we could walk and look at what those recommendations are. Maybe we'll go through our the rest of our presentation and see if there's anything that's not been answered, and if we need to pull up something and kind of go through it, we can do that.
Okay, thank you.
I think we're all ready to talk about the variance, but, we're, like, that's the meat of the matter, isn't it?
I think that's our next slide.
Yep.
So we're going to talk about the variance in a couple different capacities, and I think that, oftentimes John, Dr. Wood, and myself come to these meetings, and we kind of all talk on issues from a similar perspective. And I think for today's meeting, it's good to really differentiate between the Board of Health Administrator, myself, the Board of Health, you three, and Dr. Wood, our health officer. I think that when we get to situations like we're in now, it's really important to be clear on what our individual roles are. And so I'm going to talk first about the variance in administrative terms. So the first piece is I did send earlier this afternoon a new draft to the Board of Health. And in that draft outlined further some of the operational issues that we've moved forward on. There is still some components of that I believe are a bit aspirational. But I think that we have moved significantly closer to meeting how I understand the variances, the expectations based on their questions, as well as in particular in the component around isolation and quarantine. Some components I've learned from other health administrators as they've worked to get their applications approved. And so I hope you have a chance to look at that. I know Dr. Wood has. She made some notes. And go ahead.
JP, is that in our email?
That's in your inbox. It should be, yes, from this afternoon.
Okay.
So Dr. Wood
Okay.
had a chance to look at the first draft, made some comments. I worked to address those. That I still believe there is room for some updated data, and for some of those descriptions around what will happen, especially in agreements with community partners, for us to put those MOUs completed, signed, in our variance application. Those have been required to be executed, as I've heard from other county health administrators.
MOUs with community partners,
Correct.
who would those community partners be?
For us, that will be Valley View Medical. They will be helping us to meet our needs to have local ability to meet the contact monitoring, and I'll walk through that, but the contact monitoring and the case management. The case management support will require a great deal of staff. Early on, the decision was made not to hire a large amount of county staff in order to be prepared for that. We're hopeful that we don't have a surge. And so we're crafting those MOUs in a way that we pay for them hourly. We're not essentially paying staff full-time for a surge that may not come. And so we've got a plan for the MOU that will outline 1, contact monitoring, 2, case management, and 3, a testing strike team. So if we have a potential outbreak in a congregate setting, we will be able to have medical personnel show quickly with adequate PPE and supplies, conduct those tests quickly, work with the labs to get results and report those back to us so that we can use our capacity to do those disease investigations, work directly with new contacts. So that's the MOU. And as of today, in a conversation with the Valley View CEO yesterday, and I was hoping to have it by this meeting, but we are expecting today. I gave them what the job was going to be. They needed to break that out into how much that was going to cost per hour and what level of professional they would have doing those jobs, and to articulate if they needed any changes on what those duties would be.
Would they be in line for COVID-19 funding for that?
Yes, we would use CARES Act funding to sponsor that MOU or to fund that MOU.
So I'm trying to make a list, JP, like the MOU, Valley View, and the status is we expect it to come today. So that's almost complete.
Well, that would not be a completed MOU. That would be their description. We've got an MOU. I'm working with Amber Smith to get that executed. But what we need from them to put into the MOU language is a rate for that work, and that's what we're hoping to get today. But functionally, once we have that, yes, we could then complete our MOU, send it to them for approval, and quickly be finished. That's correct.
So would you say, give me an estimate, so you say by so-and-so date, this should be done, the MOU, considering what you have to do and
Well,
Amber needs to do.
Yeah. So earlier this week, we had talked about, and I don't want to jump ahead too much, but we talked about possibly going forward and having a vote for that variance application today. I was going to act with a plan that would be an addendum to our application, and that we could probably have that done Monday. That way it could be completed, and that if there was a Board of County Commissioners meeting that day, we could have a complete application. We'll go into reasons why that's not possible beyond this MOU, but I'm still hopeful that we can get that done. If I get those numbers today, we can have that finished by early next week.
So I know in Grace Harbor, they scheduled like Board of Health in the morning and the County Commission in the afternoon for next Tuesday to move this through their process. So we're hoping to do something similar.
Yeah, I think that, as far as, scheduling, which is often, one of the high hurdles for getting something completed, scheduling with the Board of Health and Board of County Commissioners, I'll work with Eric, and I think that we will not obviously let that be a barrier for this critical issue.
And I think all three of us will take 3 commissioners that, yes, we will be there when it's.
So that's the new draft. As we know, we are not currently eligible based on the recent cases as described by Department of Health. And I followed up with the Secretary of Health this week because I felt that there was a bit of a potential miscommunication in that we were included in a group of counties that may very likely soon be eligible. And there was seeming to be a group of us that were described as below 75,000. We're above 75,000, obviously, we know that. And so regardless of the 3-week without a case, which was already a very high hurdle, I've been informed that we're ineligible based on our population now as well, and that was clarified.
Did you, wait, back up. Did you say we were eligible or ineligible?
Ineligible.
population.
We were not eligible.
In-
Correct, not eligible. Based
Oh, you're
Based on our
kidding.
population.
based on our population.
Yeah, right. So
So,
we're not, wait,
I'm sorry, Commissioner.
county.
Right.
Was the 75,000 put in there originally, or was this just one of those add-ons, or, you know, the rules keep getting rewritten, or things are inserted where it's just virtually impossible to really get out of phase one, or if we're even in phase one?
You know, the way that they've drawn the boundaries for phase one, they've drawn those boundaries not to include Lewis County. And and
I clearly understand that, okay, what we've been told. But this is the thing that is a little concerning to me, is for the last 3 weeks, and you guys followed through with putting a plan together as if Governor Inslee was going to lift the restrictions tomorrow, so we would have something in place. And now what I'm hearing is, which we're getting some information, that's fine, but part of my problem is for the last 3 weeks, and now all of a sudden we're hearing things that we are not even going to be able to apply for the variance. When for the last 2.5 weeks, we have been telling our citizens, the taxpayers, and all the concerned citizens that we were going to be prepared, even though there was a chance that we were going to get rejected. And that's my concern.
And Commissioner.
I don't know if there's a communication thing going on, but I know what, I was not told about this until yesterday.
So Commissioner, even regardless of us being over 75,000, we were prepared to complete our application and submit it. Reasons why I am not recommending to the Board of Health that we pursue it today, and that doesn't mean that we're not eligible sometime in the near future, is as a host of reasons. The fact that we're not eligible, and this week, that 75 piece that impacts us, there was a very similar concern around how many cases, if you'd had any in the last 3 weeks. Mason County, who has put together an application that we thought was very strong, that we thought similarly outlined, although we didn't have 0 cases, showed a very low prevalence rate. I had been talking with Dave Wyndham, their director, and he was going to apply as one of this group that had been counted in the possible 6 next counties. And so on a call this week, and we learned their fate, they were told that Department of Health would not review that application at this time. And so that's one of the pieces. But if I could keep going through this variance and kind of our administrative, the 75, although we were slightly over it, I had shared that we would still be applying and that we would still be pushing through that. And so that's a piece just to know that we've been technically qualified by, or disqualified for, but that wasn't going to stop us from a variance if we felt ready. There are other reasons why we don't feel ready at this point, and we'd like to go forward with those if we could.
So this is news to me too, in terms of not being eligible because of population. Even though I saw the 75,000 and they included us, and I San Juan County. That's also, I think, like 8,000. So do we have something in writing that tells us that we are not eligible because of this? Because we've had everything I've seen, we were included.
And that was my concern and why I raised it with the Secretary of Health this week. I received confirmation late last night from Secretary John Weisman that we were ineligible for that reason specifically. I did not review that until this morning. That came in.
Copy of
So that came in last night.
That came in last night. I will forward that to the Board of Health and Eric right now. I'll do that after the meeting, actually. I got to
So,
kind of dig through there.
Commissioners, and I know we have some guests with us as well. I'm going to suggest, let's get through the rest of this presentation, and then we definitely have plenty of time for comments after that. So let's get through everything, and then whatever questions we'll have, we'll hold them till the end. So go ahead.
Okay. So the next piece there is county versus state. There's a lot of discussion going on right now about how do we move the entire state forward. And last night, the state health officer, along with the King County epidemiologist, communicable disease director, Jeff, health officer. So the King County health officer made a proposal for some new metrics. And in those, they described satisfactory levels for the entire state to go to phase 2. If we were to take those metrics and just lay them over just Lewis County, I think that we would be very likely to be qualified. And so when we think about kind of how we most quickly get to phase 2, there's two things that I, as the health director, am working on. One is to engage the state groups, and there's a lot of health directors similar to me who are feeling the pressure or feeling the call by their community to move forward and to advocate for adopting measures that are not 0 cases in 3 weeks or 1 case per million. We're talking about 10 cases. Is it 10 cases per 100,000 per week? I believe it's much less than what we're getting per week in our county. And so we're going to continue to advocate for our state, for our county, to be reviewed fairly and as an individual county. But we're also going to be pushing for the entire state to use metrics that we think are realistic and will still allow us to open safely. So that's, I guess, the next one too, as far as the possible new metrics for counties going forward. In our application, the metric we use is a CDC guideline that was highlighted by the American Center for Prosperity. It's actually a CDC recommendation that was never published, but was used by a lot of the organizations looking to safely restart and to promote the economic element of this. That's what we used in describing our readiness. And so we're still hopeful that that may be a metric that is used for counties going forward. The last thing that is important, and as the administrator for the Board of Health, I think is important to understand, is that there are letters of support that are required in this document as we apply. And there are ones from hospital administrators, and there's one from a health officer. And, you know, I think that I, as the public health administrator, need to be understanding a lot of different things. I need to understand the hardcore public health information well enough to explain it, well enough to ask for us to act in a different fashion if I think that makes sense. But as you can see, as we have these, I rely incredibly heavy on John Aplinob as our epidemiologist and deputy director, and understand the role of a health officer who's employed by the Board of County Commissioners and by the Board of Health, and who in an organizational chart does not answer to me, answers to you. And I need to, as a health director, work with our officer, Dr. Wood, to develop a plan that she will support and she will say meets the standards of the health officer for Lewis County. We don't often have times where that position is so clearly articulated and so clearly defined. We're in one of those times. And I know Dr. Wood wants to support Lewis County in its recovery around this disease and around its economy. But I also think that we need to hear from her. We need to hear from her today on where she thinks we fall short. And the conversation needs to happen between the Board of Health and your health officer. So one of the letters of support we'll need is Dr. Woods, and she's here to talk about what we'll need in order to do to achieve that letter.
Could you turn your microphone on, please, Dr. Wood?
Yeah. Hello. So we're not yet ready. We are, I think the work that we've done to prepare to apply for this variance has been very important, and I'm being very encouraged by it. So I'm going to focus on the good things right now, and then move on to reasons why we're not yet ready. So we've been working with partners. We've been working to get testing available, to get case management, and training additional staff within the health department for our case and contact investigations. However, one of the criteria is to continue to protect vulnerable populations. And just this week, we are in the middle of an investigation in a congregate setting. We do not know the extent to which infections will show up in that setting, or the extent to which those people working in the setting may or may not be infected. So there's a lot of unknowns. And without knowing those, I did not feel responsible as the person who's supposed to protect the public health in Lewis County, saying we're ready for a variance. I need to have more information. Additionally, because of this situation, I got 3 separate calls from my healthcare partners, specifically hospitals in the county, and they were from 3 different parts of the hospital system saying, are you really going to apply for a variance? We have this issue going on, and we're concerned about surge capacity. So we should know a lot more, I would say, even in a week, but without more information, I can't blindly say, yes, we're ready to apply for a variance.
So, Dr. Wood, this
Yes.
is taking off my Board of Health cap for a moment and becoming a county commissioner. This is the concern that we have as commissioners,
Yeah,
because the goalposts continue to move.
yes.
The information continues to change. And so my question for you is this: based on the numbers that you yourself have given us as far as tests go and the amount of people that have actually tested positive, my question for you is this: we have Home Depot, Walmart, 2 locations of Safeway. We have shopping cart, we have the grocery outlet, we have numerous restaurants that are doing takeout, and people are walking into those restaurants to purchase meals. Now, I'm not a health expert, and I respect your opinion, but it just seems to me that if we haven't seen a major outbreak before now, what makes us think that we're going to see one to the point that continues to shut us down and break the back of the economy? Because I can tell you, I've been in those lines at Home Depot, and there are, I don't know how many people they're letting in, but I can tell you that over the last 2 months, there have been thousands of people that have showed up at Home Depot to do shopping. Daily, Walmart has people in and out of that building. We are still not having any major outbreaks. So my question for you would have to be, based on even that information, and I don't know how much of that information you've actually looked at, based on that right there, are we not closer to getting to the point where we get to a phase 2 situation, which the phase 2 situation is minimal at best, but we're still seeing hundreds of people that walk through these big box stores and are doing business on a daily basis? That's the piece for me personally that doesn't make any sense. And that's the piece that makes me feel that all the work we've done to this point, with the inclusion of the information that I gave to JP today, which was business owners that have submitted to us business plans for social distancing so they could reopen their small businesses. So I don't understand the gap between public health and what we're seeing out there in our community right now. That's my issue. Are you following what I'm saying? I'm talking about with all the business that's being done out there and all the contact that people are having. They're still practicing social distancing, but it's near impossible for people to stay completely away from each other in those specific situations. And we still haven't had a major outbreak in Lewis County.
That's awesome.
It is awesome, but that's my point. Why, based on even some of that information, are we not able to get any closer to applying for a variance?
I think we have moved closer to applying for a variance. I think that we've been working for the last couple of weeks to line our ducks up so that we could apply for a variance. So I think we are closer than we were even May 4th. So I don't think I think that we've made steps towards getting closer to applying for a variance. And I think it's great that we're having as much social interactions and we haven't had an outbreak. I am concerned about the current situation, which is still an unknown. And the reason we did social distancing in the first place is it's part of the 13 non-pharmaceutical interventions to prevent the spread of a pandemic.
Okay, to that point, the University of Washington just put out a study that said that the pandemic peaked in the state of Washington in March. We've seen all of our numbers flatten since then. So that was the original intent, to flatten the curve and to make sure that hospitals had capacity in
You got
case there
it.
was an outbreak.
Right.
We have accomplished both of those things.
We have for now, as of 2:30 on May 14th, we have. But I don't know what it'll look like at 2:30 in the afternoon on June 14th or August 14th or October 14th. So the idea is that we continue. Unfortunately, this is really hard for I rant and rage periodically, my poor husband, about this COVID pandemic, because lots of plans that I had when I supposedly retired from Thurston County are not coming to pass because of COVID-19. So I hear you. Unfortunately, we're going to be in this for 18 to 24 months at least. And we don't have vaccines. We're trying to get medications, but we need to prevent people from getting sick in the first place. And I hear what you say, that Walmart has done social distancing, restaurants are doing takeout, and we haven't seen surges. We need to continue to hang in there. And it's not easy because of the economy. My daughter has a dear friend who's a traveling nurse who came to Washington State to work. She's been laid off. She may become homeless. And I can't believe that. I just can't believe it because she has no work. I mean, this is affecting all of aspects of our life. My job is to do what I can with the knowledge that I have and the training that I have to protect the public's health as best I can. And so, with respect, I think we have moved down the line towards applying for a variance, but I don't think we're ready now. And we need a lot more information about the situation that has developed this week.
So, Dr. Wood, and thank you for your work. This is Gary. I think the follow-up question that I would have then, we're going to get ready for this variance and we've got everything in place, and all of a sudden we hear of a potential hotspot. So now we're going to start, sending our workers out and monitoring this. So at some point, it's never going to end. We know that we're never going to eradicate it unless, like the flu, it's never going to be eradicated. We know what it is. And so at some point, I think social distancing and all the steps that the state and the feds have put in place, we're doing that. And to Commissioner Jackson's point, I went in Home Depot yesterday I've been into a couple other businesses. I'm very careful, as well as everyone else is. And I know that if it's a nursing home, potentially, then, and again, if, I don't think you can isolate people if they choose not to be isolated. But we're going to continue to chase this rabbit forever if we don't at least do something. And, I'm under the understanding too that I thought we were going to be ready to go for the variants, and all of a sudden we have a potential, more cases, which we do have one case, sounds like, but we're looking at that as a potential outbreak. So, I mean, if that's what we're going to do, we're never going to open up. And so in the meantime, while Nero is fiddling, Rome is burning. In this case, Lewis County. And so, currently right now we've got the EDC, the United Way, the Chamber trying to raise money for these businesses so they can at least pay their rent. And so there needs to be not only safety in mind, which I think we are, but also we have to at some point look at the business component of this. And again, I'm going to restate this, is I think that regardless if we get turned down or we don't get turned down, and I want the variance to make sure that we're accurate, but I want to push this to the governor. And if he chooses to put it on the shelf and let it collect dust, that's fine. But we have been telling our citizens that we're going to do this. And whether it's political or not political, it's political in my opinion. We're not following through as leaders, or I'm not. So, and I'm getting questions every day on this.
Yeah.
So I appreciate your work, and I know it's very, very difficult, but at the same time, I hope that you can appreciate what we're going through when we see dwindling budgets we know, and we haven't even had a chance to look at, the second quarter yet, because we're right in the middle of it. So there is a monetary value here, and it's going to mean jobs, and it's already meaning jobs. So I understand where you're coming from, but we're willing to back up anything, a variance, and we support that, I think, and we agreed on it a couple of weeks ago that we think we need to move this forward.
And I think, Dr. Wood, what you'll see, if you look through these business plans that were submitted to us, every business in this community wants to continue to practice social distancing, and no one is even suggesting that we throw the doors open to our way of life in Lewis County. And while there are people that I'm hearing from that are tired of hearing the quote, new normal, it is a new normal, and we get that. But as commissioners, you can understand that we are concerned about not only the physical health of our citizens, but their mental health,
And
their
social-
emotional health,
Yeah.
their economic health, as well as even their spiritual health. So we have to be concerned with so many different aspects of this.
Yes, you do.
And it's been very frustrating for us because the information keeps changing. And I found out to Commissioner Stamper's point, I found out this yesterday, 24 hours before this meeting, that we were not going to be able to apply for this. And so we've got to find a way to get to the point that we can get this done. That's the bottom line for everybody in the county,
I hear you.
everybody concerned.
I appreciate what you have to say, and I appreciate what Commissioner Stamper has to say. And I hear what you're saying.
Commissioner, if I could say something, Rob Snozzel,
Yeah,
Lewis County
sure.
Sheriff. I've been sitting here listening, and like the commissioners are upset, and we have a lot of people, and I will tell you, I field a lot of calls 24/7 about the citizens of Lewis County. There's two numbers that I think about every day when I read this information. I think about 0.03% and 0.003. Do you know what those are? 0.03% is the amount of people infected with COVID, that have COVID, tested positive for COVID. 0.03%. The second part is 0.003 is who have died of it. Not directly of COVID, more than likely have died of other underlying issues, but with COVID attached. So I'll give you those numbers. And you talked about really hard stuff. And let's get this clear. You guys are working hard. I appreciate it. I really do. Working really hard. So what we're going to say is we're going to tell 80,000 plus citizens of Lewis County that we're going to want to wait. and we're going to wait for a surge that may or may not come. We don't know that because if I was to play the stock market, I could ask if there's going to be a surge as well. But that's hypothetical numbers. So we're looking at this. So when I look at it as a law enforcement official elected by the people, I'm thinking about religious freedoms, constitutional rights, and then you want me, or somebody wants me to say, hey, I want you to stay home, stay healthy. So if we're doing this, and you said 18 to 24 months, my concern is we have over 100% increase in suicides just since the diagnosis of COVID. We've had a huge amount of death increases. Crime rate has gone up, all these other things. So we talk about your friend possibly losing a job. I'm worried about half the population of Lewis County losing their jobs, losing their homes. That means something to us, each one of us as elected officials. And so what I'm being asked is to follow the law. I get a phone call, and I appreciate the phone call saying, I need to enforce social distancing. And you guys are going to ask me to go out and either verbally educate somebody, cite them or whatever, and we'll do it on a case-by-case basis as we continue. But at the end of the day is, how long do we tell people to stay inside, to not work? That's called socialism. Last time I checked, this is a capitalism. And we are pushing socialism. I'm not trying to get on this agenda, but what I'm saying is the goalposts are moving every time. So how do you sell it to somebody saying, for 0.03%, I'm asking you, Mr. John Doe, to lose your business. I'm asking you to shut down and never come back. And by the way, I'm sorry your kids are not going to school. I'm sorry your kids won't have the life that I promised them because we may not have a home next month. So what am I to say to those people? There's going to be a point where people, and I'm not advocating civil disobedience, that's not what I'm asking. There is a point to where people will listen. You guys are professionals, you know. There's a point where people are going to say, I'm done. I will tell you this. The people of Lewis County are done. They want to start their businesses. They want to go to work. They want to show pride in themselves. They want to feel that pride that they can go and provide for their family, to put food on their table, because those bills that are sitting on that countertop are still stacking up. And there is no help that they're going to get them through this. But we need to work together to push it. I signed off on this variance. I think we should go for the variance. And I'm going to tell JP, you better start working 24/7 because people are counting on you. 80,000 plus people are counting on you, JP Anderson, to get this variance done and move it on to get signed. It's on your shoulders. You took this position. I expect you to do it for 80,000+. And I'm telling you guys, the only reason I'm saying this is because this is a conversation that needs to be had. This is a conversation where people are calling us. When I have someone saying, I need to go to church, are you going to arrest me? I'm going to tell you right now, I am not depriving anybody of their religious freedoms. I refuse to do that. I have my own atonement. I have to answer to the good person myself. And I am not going to tell somebody not to go to church. I'm not going to tell someone, don't open your business, because it's not the sheriff's office job to deprive them of earning a living. So I know it appears that I'm venting, but I'm telling you, I'm venting on about 80,000 people who can't be here today that are frustrated, like all of you are in this room. Everybody in this room is frustrated, and we want to get back to normalcy. There is no new normal. I don't believe in that. We need to move on, and we need to get our lives back. And thank you for listening.
One number, as you cite those, there's a number that we have to look at every day too. And you're right, the infection rate's low, and it hasn't come yet. But the number's 10%. And that's how many people have died that have gotten this disease in Lewis County so far. That's not what I think it's going to be. That's not, I think all estimates, the 4% we were worried about in March, I don't think that's going to be what it is. But I think it's not here yet, and we don't want it here. And everyone agrees that. The piece that we think businesses can manage this, and we think our citizens can follow these social distancing rules, and we can handle it ourselves. I agree that if there's any community in this country that can do it, it is Lewis County.
Well, they're doing it already, though.
You're right.
There's businesses that everybody's talking about. They're doing it. You go to a restaurant and if you told them, if you could open up tomorrow, if you followed these protocols, would they do it? Absolutely they would. Everybody who has a business would do exactly what you asked them to do because they want to open up tomorrow. If you said they could do it today at 5, they'd open up today at 5. So I get, you're saying 10%, you know, when we talk about the population, how many have been tested? I mean, there's a point of how many tested, how many have been tested, how many have been false positives, how many have tested and not had it, but had it, and we, you know, it's been here for a long time.
And to your point that it's on my shoulders to get a variance.
It is. I'm putting it on your shoulders. The sheriff's office is.
I can appreciate that, Sheriff. And I've worked for the sheriff's office. I've worked with the sheriff's office. And last night at 10:30, when we were not able to get an issue resolved otherwise in this community, I was able to call the sheriff's office and get that resolved. I have great respect for you personally. I have great respect for the constituency you represent. And I know every day I come into work to serve them. And how this event has unfolded has been something that there was no public health director, no public health professional in this country, in this world, that was really deep down ready for it because none of us had been through it before. I think that when we consider why we're not at phase 2, there are failures well beyond our county borders and well beyond our state borders and well beyond our national borders around how we prioritized and how we planned and how we did emergency preparedness. 2 months ago, we were on the phone screaming at people to get our tests done now, to get the PP in this community now, and it didn't come. And right now, the line is, we're hoping to get it next week so we can increase testing. And I don't know how to make swabs. I don't know how to make testing media. And it's incredibly frustrating. It's been incredibly frustrating for everyone on the IMT. Every day, me and John go into the office. The problems are more. They're more complicated. But I won't shy away from that. You're right. It is up to me to get a variance. It is up to me as the public health director to provide a plan for us to get there. And I'm not giving up on that because it's not happening today. And I don't think that we ever get to our best effort without working together. And I know you don't either, no matter how much we may discuss things. And we always have on a variety of issues. I think that we're able to accomplish great things, and we have, and we will on this. And Lewis County can come out of this known as a place that has not had a high infection rate, as a place that's safe to go to, as a community that you want to be in. And I think there's going to be a lot of people that want to be in a place like Lewis County after an event like this, that this is a desirable place to be. And the fact is, we're waiting to get geared up for them to release COVID. And once they release it, it's going to be here. You're right, maybe forever. And public health needs to be ready. If we say, put us in, coach, we got it. We got to have it. And to come in here and say, I got it to win some points today, but not be ready in a month, 2 months, 3 months, 3 years from now, I can't do it. But I can tell you we're getting ready as fast as we can.
Well, I will tell you this, and I have all the faith and trust in you and your team. You have an excellent team. One question I have is, how long are we asking our citizens to stay in phase 1? How long is that? Are we looking at phase 1 through the summer? Because if we have an incident every 20 days, does that roll us back?
No. I think that, if there was an event that was dangerous to start saying what you think and accidentally turn it into what you hope, it was this one. But I think that June 1, that we are hopeful that this state, the way the numbers are coming out right now, the way they're changing as of last night at 10:30, they're starting to change what the state criteria are going to need to be. I think that June 1 is going to be a meaningful date. I don't think that we're going to be able to stay in, as you've said, people are already opening. Health directors around the state know that's happening. There are sheriffs around the state saying the exact same thing you're saying. There are conversations with healthcare providers on how do we keep people safe, knowing they're not going to follow directions. We can tell kids not to do drugs, but at a certain point, it's time to start harm reduction. and making sure they're safe even if they're going to do it. And health directors around the state are trying to figure out, how do you make sure people are safe if they don't follow the rules? How do you make sure, we think about this when we try to address drug problems. People are going to use, how do we make sure they don't overdose? So we are moving into a next phase, and this is not going to hold, and it's not holding. And we're working our hardest within the system to do our best.
Can I say something?
Certainly.
So I was sad to read, but I totally support that we're not going to have the Lewis County Fair. And I saw that the last time we didn't have the fair was in the Second World War. I'm going to get teary because my father-in-law, who's 92, we've had family conversations, and some of you know that he did get COVID, and he was hospitalized for 17 days and has been in a skilled nursing facility for another 2 weeks, and just went back to his assisted living apartment. When I was taught, I've been trying to play the role of telling my daughter, who is a third-year medical student, what's the biggest thing that's ever hit her life, which is COVID. I said, it's the biggest thing that's ever hit my life. And when I asked my father-in-law what was the biggest thing that ever hit his life, he said World War II and COVID. So I appreciate, Sheriff, that you said we are working on this together, and we all have our roles to play. And I don't envy your role. And commissioners, I have deepest respect for all three of you because I don't envy you your role. I deeply respect what you have to do. And I have, the part of me that's not the health officer really would like to go out to breakfast here in Lewis County and to go see my sister. It was the 100th anniversary of my mother's birth on Tuesday, and I had plans to go see my sister get on an airplane, and I couldn't. So, I'm having to fight with myself. But you chose me to protect the public's health, and that's the job I have to do. I have to look at myself in the mirror at night and say, I'm doing the best I can. And with respect, I respect what all of you guys are doing, all of you, and we have to do this together. I swore I wasn't going to cry. But so I don't think it's easy. The only thing I would say to the listening public is, there's so much pain with this, and my heart goes out to all of you. And I don't, all I can say is we got to keep trucking on. And if anybody can do it, Lewis County can. I became the health officer here in July of 2007. And on my birthday in 2007, we had the worst flood I've ever seen. And this county hung in there, and we had people meeting in Granges. And so I know we can do this one too, although it's bigger even than that flood. And I don't have all the answers, but I see myself as part of a team with all of you. So thank you.
Thank you, Dr. Wood. Commissioner Fund, did you have something you wanted to share?
Yes. I tried to get in several times and I realized I'd muted my phone. So what the sheriff has said is very accurate about our folks out there being uneasy, being scared, being afraid of losing their businesses. And we have folks who are very afraid of getting COVID-19. It's a very difficult time in our country. So when I go back to see, okay, how do we get this variant moved? I'm trying to pick apart what are the things we need to do to make it go forward. While we're having this meeting, I texted our senators and representatives about what's going on and said, this is tough right now. We've got things to do, and we've got obstacles. So I'm going to read, Jim Walsh says, keep going. They're changing parameters for variances as they go. Make the application and wait for Washington Health to come to you. I haven't heard back from the rest of our folks, but I think it's healthy for us to say what's on our mind, to say we got to get this done, and that we need to continue to have a plan to work on this. I'm always like, okay, like I said earlier, before we were trying to get through this process, but like which of the various issues do we have covered? What are the ones that are left? What are the other areas that we need to work on to make sure we're ready? Are our PPEs all ready? What do we need to do with our hospitals? So I know it's a big job, and maybe we need more people working on it. I'm not sure, to make sure, because people are working 24 hours a day. You know, we're not getting the work done in an efficient manner. It is a stressful environment right now. So for me, I want to see what are the outstanding issues that we need to work on.
Mhm.
At the same time, I'm concerned about a particular outbreak in a congregate care facility, and what that might do, and how are those folks. And I want to know, okay, what is the timeline from that testing to when we will know whether or not we have a big COVID issue there? I also want us to work on the 75,000 thing. And I think JP had said there's some other items that are going on that may soften some of this. But I want a list of the things to do so we can move ahead. It's good to vent and get everything on the table. Now's the time to work our plans so we can open up our county and keep our people safe, and whatever that takes. And once again, as Sheriff Snaza said, people are very restless.
Mhm.
But I feel better if I know what are the things we need to do, what are the hot spots, and let's check off each one as we accomplish them. And we have 19 other counties that have just sent a letter to the governor saying, we want more control, and we're different, we're rural counties. We want to continue that advocacy on the political side, as well as getting the work done in our county in terms of this variant. We have to have all hands on deck. We need to be a unified front, and we need to work together. This, as I've heard people say, this isn't going away, but we have many of our businesses that are in fear of going away. We still, like I say, have folks that are very concerned about getting COVID-19. And when we don't know some of the information, people are putting things out, well, it's because of those people at Walmart we have this, or it's just older people, so I'll never get it. You know, we've got data out there, and I feel like we need agreeing, you know, that this is the data, this is what's happening in Lewis County. These are the items that we're working on right now. People are just wanting to get something done, and I think we did a lot of venting, but now it's time to put our plan together and take assignments and move forward. Thank you.
So JP, the information that Commissioner Fund is asking for, I think it would be beneficial for all three commissioners to have, so that we have an idea of what information we can work on, we can help the health department work on as we talk to our constituents out there. I almost hesitate to ask you about a time frame because, as we've said before, the information tends to change almost on a daily basis. And so what you're telling us is that by June 1st, there is a hope that we can actually be moving into a second phase. So originally when this started, we were looking at a possible 2-week window. We have hit that 2-week window. Not going to happen according to what you're saying. So we're looking at least another 2-week window with the same hope. And so is that that's what you're telling us?
I don't know if it's possible that the state could move faster than that 2-week window. Given the parameters we have now, it doesn't seem that we would be able to. If we go to our next slide. Next steps in readiness. So I think we had the same thoughts you guys did on what needed to happen in this meeting and on what we needed to do to accomplish a readiness. And I think that the conversation around variance is important, but we all know that phase 2 is not where we want to be either. We want to be well beyond phase 2.
Right.
And so we want to think about readiness for the variance, but I think we want to broaden that out and think about readiness in general for COVID. So we'll start with some things that are associated with the variants, but they have to do with our readiness to handle this disease potentially in the long term. So we need to finalize our MOUs. We've got just this week some developments, hopefully to get some more isolation capacity at the Southwest Washington Fairgrounds that could be moved in temporarily and that could be moved out afterwards. So we're looking at that as a possibility to increase our isolation capacity. If we are going to move forward, it is appearing that we do not have adequate isolation yet. That's one MOU. The other one is Valley View. The Southwest Washington Fairgrounds may not be an MOU. That's actually construction to have RV sites and to have those then contract, should we need to contract for RVs. We would use CARES funding for that. We would also use CARES funding for Valley View. So those are things that, we don't even have the CARES funding document yet, but this stuff is backed up, but we need probably the commissioners to look forward and approve some of those things when they come in. And so I know we're right in the middle of that process right now of putting together where are those priorities, how's that money going to be spent. So that's one thing we can do, and that's one thing you guys are definitely a part of. That's the piece I said about ensuring adequate isolation and capacity, continue working with healthcare systems to increase test availability. So we need to work with Valley View, who's doing some testing, but also our other health partners to make sure that what we're doing is we're doing broad testing for anyone that meets those criteria of having a symptom associated with COVID, and that we're doing that in order to, one, get more information around what do we really have in our community, two, show a high level of testing, and if we do in fact have a very low prevalence, that gives us that low positivity rating that will score us better in a variance application to come. Increase availability of information and recommendations. So we've got incoming requests from youth groups, HOAs, schools, you name it. They want a recommendation, thumbs up or thumbs down on us if they should do an event or if this is safe or can people come back now. We don't have the capacity to answer all those questions. What we need to do and what we're already doing, we need to continue to basically build a library of good material, and then we can tailor that to what they need and make sure we're connecting them with resources. A big part of public health is community ed and information, community education and information. So we need to ramp up those, and I've been talking today about how we can do that. Using some staff that work on similar project, our PIO being one of them, to essentially build our library, because what's happening as we move forward, the community is asking for information. I was lucky to be a part of the Business Recovery Toolkit group that put that together. That's an incredible document. The group that put that together, Centralia Downtown Association, Chehalis Renaissance, Larry McGee, I'm so proud of that. We heard about what was happening in Seattle, their time frame. We're trying to get involved in that. I was trying to get us connected with that. Well, we just got it done quicker here locally. And I think that our information going out and the plans that you provided today show a readiness on our business community to implement those things and be safe. But we want to continue to make sure they have that information. It's available to them. And we need to make sure everyone knows that we're not going to be thumbs up or thumbs down. And we're not enforcement, but what we are is we're here to provide information. So recently had someone talk to me about an event they wanted to have, and what I could tell them was, it sounds like you've considered the recommendations around social distancing. Sounds like you're making plans to keep people safe. Okay, but my boss wanted it to be okayed by somebody. I'm telling you that sounds like you took all those things into account. I think you're doing a great job. But I would guess that our prosecutor would not want me going around giving people thumbs up and thumbs down for every event under the sun. No, he would not. So we've got to make sure I'm staying in my lane there while still being helpful to people. Or we're staying in our lane, because that's happening for all our staff. And then we need to continue working at the state level to advocate for the health of our community. And when we say health, we don't just talk about our physical health. We need to articulate social determinants of health, and we all need to understand that language, because that's the public health language that describes the things we're talking about right now around economy, around what happens around crime rate, and we need to really understand that, because that's been something that has been, as a social worker and as someone who came in with a social services background, that's been my primary focus well before COVID, was the implications of the social determinants of health are what really predict health outcomes for our kids. Can mom and dad have a good job? That's how you know one way, you know that when they grow up, that they're not going to have, they're less likely to have addiction issues, heart disease, cancer. All of these things get connected to social determinants of health. And when we think about the trauma that happens from an event of telling people to stay in their homes, of mom and dad losing a job, of being disconnected from your community, we are having profound impacts, negative impacts on the social determinants of health. So we need to address those in a meaningful way. We need to talk about them in a meaningful way to make sure that they're being taken into account now. And we need to address them in a meaningful way well beyond our variants, well beyond COVID. And so right now there's an opportunity for us to get a shared understanding on what our value is around that, what our direction is around addressing social determinants of health. And we need a springboard out of this to do that in a meaningful way going forward, because it's where sometimes public health people are disconnected from what seems like the economy or people that are thinking in economic terms. They're not. We know they're not. We need to be able to talk about how they're not and use the partnerships we're building now to go forward and to promote health in a meaningful way with partners that maybe weren't involved with public health before that have come on board in this. So those are the readiness steps, but I think, you know, we can make this an editable document, and if there's something that you guys want to put in there, we'll take this away and have it be some of our next steps for readiness, and we'll take that as a directive by the Board of Health, and we'll work on it.
So
Commissioner?
JP, Commissioner, so I heard you say about one person you're potentially pivoting into working on some other items. Do you have other plans to pivot some other people so we're carrying this burden well and people can get work done?
Yes, I've got a meeting with Eric Martin and Becky tomorrow. I am advocating for us to get a financial person in our office because we have an incredible amount of administrative work that I am working on, John is working on, we're trying to sort through while we're also building out these interventions. And so we need some support right now in our fiscal department to navigate these CARES dollars that are coming in, put together the pieces and track what's going on with our MOUs, and make sure that we're ready. There's an influx right now, as much as everybody is hurting, there's an influx right now from the Department of Health, from the federal government on what are supposed to be public health interventions. And so we needed some support in that capacity as well, Commissioner.
Or soybean.
I haven't heard anything from our manager. Eric, do you have anything to say? I'm sure you have plenty.
Okay. Just trying to take this all in and listen and educate myself. Obviously, like JP said, we do have a meeting set up for tomorrow, and you know, I'm in full support of trying to make sure we're finding the right solutions for everything we need. So we'll be talking about that and discussing exactly what that person might be doing. But obviously, I think we want to be supportive of what public health needs at this time more than ever. So we'll be taking that information from JP, and then I think Becky and I have plans on Monday to go into detail with the Board of County Commissioners on what is available in the CARES Act as far as coronavirus relief funds, and we'll be making some recommendations at that point about what we think you might want to spend that money on based on feedback we've gotten from both public health and several other internal and external stakeholders.
Okay. Is there
So
anything?
can we have a more formalized plan with deadlines and objectives for our meeting on Monday as we follow up on what we've discussed today?
Did you say deadlines, Edna?
I said objectives, goals, and deadlines. So we know when we satisfy what needs to happen, and like research on the congregate care facility 2 weeks from this, we will know whether it's a continuing issue for us.
As far
I
as
feel like pieces all over, and it's not quite spelled out as well. And I want to be able to talk to our constituents and feel like we're organized. We know what the time period, because they hear, well, it'll be done in 2 weeks. Well, we got other things. We got other issues that we need to resolve. So I would like something more spelled out for my purposes. I don't know about the rest of you.
Well, I think if it's possible, then yes, all three of us would like that information.
Yeah, we can absolutely have a detailed, and if it suits you guys, I would like to frame that in a readiness. I can put an asterisk next to things that are required for the variance, but I think I would like
Yeah.
I would like to really start outlining these things in just a general readiness, because they're going to have implications beyond phase 2. And everyone's used the phrase "build the plane while you're flying it." It's been maybe a bit overused, but we're flying it and it's moving. But we need to now make some improvements, and we need to get ready for a very long flight. And so let's. I'll put that together. I'll work with Eric and the rest of the IMT. We've got lots of people working on this that aren't here today. I think of Steve Wold, who's doing work today on making sure that we're moving forward with those increased isolation facilities. Other members of the IMT. So we've got a lot of people doing this, and there's a lot of work going on that isn't at the table right now. We've got staff that had to drive up to Tumwater today to get test kits so we could follow through with an investigation. We've got someone on the phone right now pressing hard and hopefully keeping her sanity while she deals with some of the bureaucracy that slows us down as we try to go through this work. So we've got a lot of people doing that. I'll work to have a list for you guys Monday that really outlines clearly what needs to happen next, so you can share that with constituents.
Okay. Is there anything else?
Yeah, Commissioner Jackson,
Yes, sir.
I've got a couple things here. On a positive note, I know that Steve Wold had mentioned yesterday that the parks will be open up this weekend, I believe.
Mm-hmm.
And I know that Steve was specifically talking to Sue Kennedy at Public Health to make sure that happens. So I appreciate that, because it will allow some people to get out, and I'm very happy about that. And the last thing I want to mention here real quick, and then I know Commissioner Fund probably has a follow-up here. This is a letter that the 19 county commissioners, well, all the county commissioners signed off on this. And I'm just going to give you just a little snippet of it here. And it was addressed to Governor Jay Inslee. And it says, as you stated in your launch of the Safe Start plan last week, I'm sorry, I messed up here. I'm touching my screen. It's not working very well. Anyway, you have not yet won the fight against the virus. If you do, in fact, truly understand the impact to your citizens, you will realize that the glacial speed of this process is killing our citizens of this state in ways the virus does not. It is killing them financially, emotionally, and through undiagnosed other physical conditions not attended to due to the fear of our inability to see doctors go to the hospital. We collectively urge you to alter the current narrative to follow, I'm sorry here, to fully realize the impact this having on families, workers, and businesses, that we have not yet won the fight of the virus. So anyway, I'm not going to read, and it talks specifically a little more about, and I'll kind of read the last paragraph here. You understand the emergency, under the emergency power and trust of the governor, have the ability to turn this around. Please do so. As elected officials, all of us serve the people, and we need to lead them in the way that preserves not only the physical health and the safety, but their economic health and safety. We believe this can successfully be done in tandem at a more rapid pace that is being currently done. Okay, so anyway, we're going to post this. This is the letter that was sent out, that 19 counties signed it, county commissioners signed it, and we're going to put this on our website. And I guess this is a question for Eric. Are we getting all of our correspondence that we are receiving about this on our website, on the Lewis County website?
I believe it's already posted.
I have heard mixed emotions on, or mixed reviews on this.
I'd have to look. I saw the first couple comments that came in, I think, when we posted it yesterday on Facebook.
Okay.
And there were some mixed, I would say more positive than negative, but there were a couple comments from people that were concerned about what opening might do to the spread of the virus, but I'd say probably a lot more that were supportive.
One of the things, just to dovetail on that just a little bit, this was the collective work of 20 total counties over about a 3-week period. And I think we went through several drafts before we finally came up with a final draft. That's been posted on Facebook and I guess on the website, but from what I've been following, it has been shared, I don't know how many times, but quite a few times across Lewis County. So it was a collaborative work with a number of county commissioners and a number of people had some input into that. So I thought it was very well written. Commissioner Samper, anything else?
However, I have gotten calls and said, what are you commissioners doing? I haven't seen you do anything to work with other counties to push on making counties relevant in this issue. That we've posted. I guess we just need to continue talking about it and saying, this is what we're doing. And if people have a suggestion for us, I appreciate that, those suggestions coming to us. And I know I had like 3 people this morning call me and say, what can we do to help?
Mm-hmm.
What can we do to be positive efforts as we try to help our county? So people are just thirsty for the information and they're eager.
And to have 20 counties to sign on to this, you're talking about 60 county commissioners all agreeing on one thing. That's a miracle.
A miracle.
So the letter is out there and it has been seen and we are getting some positive feedback. And of course, we've got some concerns as well. But commissioners, is there anything further?
I just got one other thing. And again, I know that it's, there's no fault on this, but it appears there's a communication issue possibly. And again, I know that because I want to make sure that I have all the most up-to-date information I can that we can share with our with the county residents. And so if there's information that needs to go out, and I'm not talking about on it doesn't need to be put out on Facebook or anything like that. I think that we need to have that. And if if that's led by, if that needs to be shared to Eric and then Eric passes out in the voice, I don't care if it's text, email, whatever that may be. I think that we need to have relevant information as quick as possible so we can let our county residents know what's going on.
I will continue. Great. Yeah, I will continue to work as hard as I can to get you guys information as soon as I can. I know that our department will continue to do that. We talked about on March 9th at our Board of Health meeting around risk communications. That is, what that really means is getting out accurate information as soon as possible. That'll continue to be a big part of this, but I'm hearing you want more information. Personally,
I think we
as the
just
Board of
need
Health,
to be kept up to date. All 3 of us need to be kept up to date because we're getting questions from all kinds of folks throughout the community. And the answers that we're giving them, and I think that's been made very plain today, the answers we're giving them is old information. It's not actually, current. So that's what we need.
Soundboy.
great.
Yeah, sorry about that.
I'm happy to do that. I have work to do that. We'll continue to do so. And we'll work to make improvements wherever we can.
And just a reminder that next week, I heard that we will get the number per district of recovered individuals. We have further data to review.
That's right, Commissioner. And another piece here from our next steps, we know that this information is critically important to the community. And often we talk about what our perspective is and how it's different, and knowing some of that and how frustrating it must be not to have any. And so we're going to look for ways with our outreach team to find other pieces of information, and not just general information, but local data. It might not be able to be positive cases. But we're going to look for ways that we can provide good, relevant information around COVID-19. And I think that there's been some significant changes in the way a lot of people think, and that will continue to happen. And if there's ever a time where we can ethically go forward and put more information out more rapidly, we'll do that. And we want to make sure that we're maximizing social media if we ever start going into a different phase, or if something becomes eligible, or if we feel like there's something new that's safe to do. And so we'll look for ways to do that and continue to find ways to put our communication out more out front of what we're doing. As it has been shared, it's been a time of a great deal of work for our department, and we will not lose sight of the communication elements of that.
So I received a text from someone saying that that some of this discussion was also in the Chronicle today. I haven't looked at that. So it might be well that we're notified that information is out so that we can respond if people are reading it in the newspaper.
Yeah, I think that's good. I get a lot of stuff sent to me from the Chronicle. I don't read it as soon as it comes out. I've joked it's a bit unsettling to realize when you talk, by the end of the day, it's written down somewhere and sent out in a newspaper. That's still a new phenomenon for me. So we'll work to do that as best we can.
Yeah. I guarantee you, we have constituents to do.
So, Sheriff Snoz, are you still in there by chance?
Yes, I
I
am.
see him.
Okay, I appreciate the information that you shared as far as some of your responses and the different, the different situations that your sheriffs are put in at this time. So if you could continue, to pass information on or whatever that might look like, it'd be very much appreciated, because I do think that you bring up the underbelly, so to speak, of what's taking place right now. So very much appreciated.
Well, thank you. And
Thank you.
we'll continue to do so. I know we're part of the team and working with everybody here in this room, and we continue to have meetings, and we'll continue to address these issues. And I think as we go on, we hear from everybody in here, and Dr. Wood and John and JP and everybody. And one thing I will tell you, everybody in this room, is we care about our citizens of Lewis County. We care about the health and welfare of our communities, and we want to see our community flourish way beyond this. And that I hope for a time that there will be a day where we'll be able to look at the rearview mirror and say, wow, we came out of this in 2007 with the flooding. We have some great people in our communities. We're going to make it through this. These are really tough times, but we have the people in place to make things happen. And I want to thank the commissioners and all the electeds. They've been very supportive and making this go forward. So thank you, guys.
All right. If there's nothing further, we will entertain a motion to adjourn.
I make a motion to adjourn.
Second?
All those in favor say aye. Aye.
Aye.
We are adjourned. Thank you, everyone.
And then the governor has his press